There are different diseases of the prostate, including the benign prostatic hyperplasia, prostatic carcinoma, as well as prostatitis, which is the inflammation of the prostate. So starting with benign prostatic hyperplasia, the incidence of BPH increases with age and is particularly seen after the age of 50. And this condition is more commonly seen in black men due to their large prostates. Now, I would like to remind you that conditions like hyperplasia as well as metaplasia can progress into dysplasia, and then from there on they can progress into cancer. But then benign prostatic hyperplasia is one exception that never progresses into cancer. So benign prostatic hyperplasia is not pre-malignant and it does not progress into prostatic carcinoma. In any case, this type of hyperplasia results in the presence of nodules in the periurethral regions. So here we have the urethra, and so the nodules arise from the mid-lobe as well as the lateral lobes of the prostate. So these are the lobes that will be affected. And so therefore, due to the impingement of the urethra, these patients will have urinary obstruction. So symptoms of benign prostatic hyperplasia due to the urinary obstruction include the increased frequency of urination, nocturia, where the patient needs to go to the bathroom multiple times during the night, urgency, where the patient has a sudden urge to urinate, hesitancy, where the patient is unable to urinate, as well as a weak urinary stream. And so complications that can arise from untreated benign prostatic hyperplasia include the urinary tract infections, hydronephrosis, where there are swollen kidneys due to the buildup of urine, as well as renal failure. And then for the diagnosis of benign prostatic hyperplasia, you could ask for the history to see if any signs of the urinary obstruction are present. You could perform a digital rectal examination. So here you can see that the prostate is in a close proximity to the rectum. And so by digital rectal examination, the examiner will stick the finger inside the rectum to be able to feel the prostate. And so with the benign prostatic hyperplasia, since there are nodules in the midline as well as the lateral lobes of the prostate, there would be symmetric enlargement of the prostate, and so therefore on the touch there would be smooth surfaces. But then on the other hand, if there is prostate carcinoma, there are nodules that are developing in the posterior lobe. And so the prostate carcinoma would be asymmetric and present with nodules. So that's one difference between the prostatic carcinoma as well as the benign prostatic hyperplasia. In any case, so with the benign prostatic hyperplasia on the digital rectal examination, there is a symmetric and enlarged prostate with the smooth surface. And then one other finding is the elevated free prostate specific antigen. Now regarding the mechanism of pathogenesis of benign prostatic hyperplasia, is due to the elevated secretion of dihydrotestosterone. So it's the androgen that is being converted into dihydrotestosterone via the 5-alpha reductase enzyme. So elevated level of dihydrotestosterone can cause enlargement of the prostate and cause this urinary tract obstruction. In addition, DHT is also responsible for male pattern hair loss. Now, in terms of the treatment options for benign prostatic hyperplasia, you could provide these patients with alpha adrenergic antagonists, like for instance, terazosin, tamsulosin, as well as doxazosin, and these medications should be used as the first treatment option before you try the other medications. And how these medications work is that they would cause relaxation of the smooth muscles of the bladder neck as well as the smooth muscles in the prostate, as a consequence of which they would increase the urinary flow. Now let me ask you a question. What is the side effect of alpha adrenergic antagonists like for instance terazosin and tamsulosin? And so the side effect of these medications is first dose orthostatic hypotension. And so due to the development of the orthostatic hypotension, on the first time that the patient is taking the medication, it's recommended that they lay down after taking their first dose. But then after the first dose, when they're taking the medications later on, their body will be used to it and there won't be any more development of the orthostatic hypotension. The next group of medications are the 5-alpha reductase inhibitors, like for instance the finasteride. So you know how 5-alpha reductase is required for the conversion of androgen to dihydrotestosterone. So by inhibiting the 5-alpha reductase, therefore there would be decreased level of DHT, and so it will help with the symptoms of benign prostatic hyperplasia. And then the side effects of these 5-alpha reductase inhibitors, since now there is decreased level of dihydrotestosterone, includes decreased libido. But then at the same time, since DHT was responsible for male pattern hair loss, therefore these patients will have increased hair growth. And then if medical therapy is not effective, then you can consider the transurethral resection of the prostate. And the side effects of TURP include, for instance, erectile dysfunction, as well as retrograde ejaculation. The next condition is prostatic carcinoma, which is more commonly seen after the age of 50, and it's more common in blacks, and then after that it's more common in whites, and then it's least common in Asians. Now this type of cancer arises from the posterior lobe of the prostate, so it's in the posterior, also known as the peripheral zone of the prostate, but it's only 85% of these tumors that arise from the posterior zone. So not necessarily all of the prostate carcinoma are arising from posterior zone, and that's the reason that some of the investigators are against the digital rectal examination, because first of all it's a subjective exam, and second it misses those 15% that doesn't arise from the posterior zone. So let me go back to the image here again. So if the prostate cancer arises from the posterior zone, which is for the 85% of the cases of the prostate carcinoma, then on examination there would be nodules with asymmetry or induration, which suggests cancer. But then if the other 15% is from the other areas of the prostate, then on digital rectal examination the examiner would not be able to detect it. And then similar to benign prostatic hyperplasia, these patients can present with urinary frequency, urgency, as well as hesitancy. In addition, there could be hematuria where there is blood in the urine, but this is an uncommon presentation. But then, despite this is an uncommon finding, if you find blood in the urine of an elderly patient, then you should definitely consider prostate carcinoma in your differential diagnosis. And then for the diagnosis of prostate carcinoma, you can consider digital rectal examination, but once again, not all examiners are agreeing with digital rectal examination. However, if on digital rectal examination you do feel nodules, induration, or asymmetry, so if here on digital rectal examination you feel nodules, induration, or asymmetry, then that's the time that you will have to proceed with the biopsy of the prostate. And then if there is also elevated level of PSA, you should also proceed with the biopsy. And so the kind of lab findings that you see with patients that have prostate carcinoma includes the elevated total PSA, but then decreased fraction of free PSA. Now, in terms of the screening guidelines, it's recommended to perform the digital rectal examination as well as the PSA testing beginning at the age of 50. But then after age 69, or if the patient has comorbidities that limit the life expectancy to less than 10 years, then that's the time that you should stop screening. And the reason for that is that the prostate carcinoma is a very slow developing cancer. and it takes more than 10 years for the patient to die of the prostate cancer. So if the patient is after the age of 69 or have comorbidities that limit the life expectancy to less than 10 years, then you can stop the screening for the prostate carcinoma. Now, the types of metastases that are seen with the prostate carcinoma are predominantly osteoblastic in nature, and these lesions are commonly affecting the axial skeleton, like for instance the vertebra. And so therefore patients generally present with lower back pain. And so since the osteoblasts require an alkaline environment for making the bone, therefore there would be an elevated level of alkaline phosphatase in patients that have osteoblastic metastasis of the prostate cancer. And then the treatment options should be directed at suppressing the serum testosterone level, which can be done either medically or by surgical orchiectomy, which you remove the testicles. So you can decrease the level of the testosterone by surgical orchiectomy, or you can provide medications like for instance leuprolide, which is a GnRH agonist. And so if there is a continuous treatment with the GnRH agonist, it will suppress the level of luteinizing hormone, as a consequence of which there would be decreased androgen synthesis. And then the other medication that you can use is the flutamide, which is an anti-androgen medication. The final condition is the prostatitis, which can present in two forms: acute prostatitis and the chronic prostatitis. So the acute prostatitis is from the bacterial infection of the prostate, and the organisms that are responsible for urinary tract infection are usually the underlying cause of prostatitis. And so therefore, given that E. coli is the most common cause of UTI, it's also the most common cause of the prostatitis. And so patients generally present with fever, dysuria, lower back pain, urine dribbling, as well as the cloudy urine. And then on digital rectal examination, since there is inflammation of the prostate is warm and painful to touch. Now, given that the prostatitis is caused by organisms that are causing urinary tract infection, therefore you use the same medications that are used for the treatment of UTI, which includes the sulfamethoxide trimethoprim, as well as fluoroquinolones, like for instance ciprofloxacin. And then the other form of prostatitis is chronic prostatitis, which can be bacterial or abacterial, which means non-bacterial, which is the most common cause of chronic prostatitis. And the underlying cause of abacterial prostatitis is not known. So this is an unknown etiology. But then, similar to acute prostatitis, the chronic prostatitis is also being treated by application of antibiotics. And that concludes our discussion of different forms of prostatic diseases.